Welcome back to our channel. If you've been diagnosed with fatty liver or non-alcoholic fatty liver disease, NAFLD, I have some great news for you. This condition is completely reversible. In today's video, I'll walk you through powerful steps that not only help you reverse this condition, but do so quickly, with noticeable improvements in just a few weeks. We'll dive into essential foods you should embrace, and those you should steer clear of to rejuvenate your liver health. Plus, I'll share some additional strategies to supercharge your liver function and the best supplements to accelerate your recovery and bring your liver back to full strength. Let's jump right in. To truly understand how to reverse fatty liver, it's essential first to grasp the underlying causes, which are surprisingly straightforward. The accumulation of fat in the liver primarily results from overconsumption of sugars, particularly fructose and sucrose. Sucrose, commonly known as table sugar, breaks down in the body into fructose and glucose. This seemingly simple process initiates a chain reaction of biochemical events that contribute not only to fatty liver, but also to other severe health conditions like type 2 diabetes, cardiovascular diseases, certain forms of dementia, and various malignant cancers. Fructose in particular plays a unique role in this process. Unlike other sugars, fructose doesn't signal your brain that you're full after eating. This absence of signaling causes a significant problem. The brain doesn't receive the message that the body is satisfied, leading to consuming more calories than necessary. Over time, repeated fructose intake can lead to leptin resistance, where your body becomes less responsive to leptin signals, resulting in constant hunger and difficulty feeling full. This effect isn't limited to fructose-containing foods, it extends to other foods as well, creating a cycle of overeating that can be hard to break. Scientific research, such as studies published in the American Journal of Clinical Nutrition, has shown that diets high in fructose can rapidly accelerate fat accumulation in the liver. Significant increases in liver fat and reductions in insulin sensitivity can occur in as little as 1 week of high fructose consumption, heightening the risk of developing metabolic disorders. So how can we effectively manage and avoid the harmful effects of fructose? It's important to recognize that fructose is a natural sugar found in foods such as honey, fruits, and root vegetables. When consumed in these natural forms, fructose generally doesn't pose a problem. Humans have consumed fructose from these sources for thousands of years without the widespread health issues we see today. The real problem arises with the modern diet's increased intake of refined sugars and the high amounts of fructose found in processed foods and beverages. This shift in consumption patterns is relatively new in the context of human dietary history and is a significant contributor to the current epidemic of fatty liver disease. Fruits and vegetables, while containing fructose, also provide dietary fiber and essential nutrients like vitamin C, which help mitigate the harmful effects of sugar. Fiber is particularly important because it slows down the absorption of fructose, preventing the rapid spike in blood sugar levels that can occur when consuming refined sugars. Moreover, vitamin C acts as an antioxidant, protecting your body's cells from damage caused by free radicals, which can be exacerbated by high sugar intake. When fructose is consumed as part of whole foods like fruits and vegetables, our bodies benefit from the fiber these foods contain. This fiber not only slows down the absorption and metabolism of fructose, but also helps promote satiety, making you feel fuller for longer periods. Additionally, dietary fiber supports healthy digestion and helps regulate blood sugar levels, both of which are crucial for maintaining overall health and preventing liver damage. On the other hand, fruit juices, although often marketed as a healthy option due to their high vitamin and mineral content, can be deceptive. They contain large amounts of fructose without the beneficial fibers found in whole fruits, leading to excessive sugar consumption. The rapid consumption of sugary drinks, including fruit juices, sodas, sports drinks, and energy drinks, is particularly problematic. These beverages are often consumed quickly and can contain sugar amounts far exceeding the daily recommendations set by health organizations like the American Heart Association. For example, a single can of soda can contain up to 40 grams of sugar, which is already beyond the daily recommended sugar intake for women. Moreover, the widespread availability and marketing of sugary drinks exacerbate this issue. Many people unknowingly consume far more sugar than they realize simply by drinking these beverages. This excessive intake not only contributes to the development of fatty liver, but also increases the risk of other serious health conditions, making it crucial to be mindful of what we consume. Reducing or eliminating these sugary drinks from your diet and replacing them with healthier alternatives such as water, herbal teas, or even whole fruits can make a significant difference in your liver health and overall well-being. Understanding these underlying causes and making informed dietary choices is the first step in reversing fatty liver and improving your overall health. By focusing on whole, unprocessed foods and being mindful of sugar intake, particularly from refined sources, you can take control of your liver health and prevent the progression of fatty liver disease. To further improve the condition of fatty liver and support the recovery process, an essential strategy is to increase protein intake, particularly during breakfast or the first meal of the day. Research has shown that consuming adequate protein in the first meal has a positive impact on the amount of food we consume throughout the day. For instance, a study published in the scientific journal *Obesity*, which involved over 9,000 Australian participants, found that a high-protein breakfast is associated with reduced caloric intake later in the day. Conversely, breakfasts lacking this vital nutrient tend to lead to higher consumption of energy-dense, processed, and sugar-rich foods, the very foods that can exacerbate liver issues. Increasing protein intake at breakfast not only helps curb cravings for liver-damaging foods, but also keeps you feeling full longer, thereby minimizing the likelihood of overeating at subsequent meals. This is particularly important for those who frequently experience cravings for sugar-laden or processed foods, types of food that contribute to the accumulation of fat in the liver. For those who typically eat 3 meals a day, it is ideal to consume between 25 to 35 grams of protein per meal. Doing so allows for more effective control of daily caloric intake while reducing factors that contribute to fatty liver. A protein-rich diet not only helps reduce sugar intake, but also facilitates weight loss, one of the most effective methods for improving the condition of a fatty liver. Studies have demonstrated that losing just 5% of body weight can significantly benefit fatty liver. Moreover, a reduction of 7% can potentially eliminate non-alcoholic steatohepatitis, or NASH, a more severe condition related to fatty liver. In addition to aiding weight loss, protein plays a crucial role in repairing damaged liver tissue and maintaining metabolic balance in the body. This further supports the argument that regularly incorporating protein into your diet is essential for protecting and improving liver health. Protein not only helps maintain the structure and function of the liver, but also supports its recovery when damaged by fat accumulation. Incorporating protein into your daily diet, particularly from nutrient-rich sources such as lean meats, fish, legumes, and low-fat dairy products, not only helps you manage your weight effectively, but also creates a favorable environment for liver recovery. When your body is provided with the necessary protein, it becomes more resilient against harmful factors, thereby improving overall liver health and preventing the progression of more serious conditions. To optimize your protein intake, it's important to balance your protein sources with the types of fats you consume. While meats and dairy products are rich in protein, they can also contain high levels of saturated fats. These fats are commonly found in red meat, processed meats, high-fat dairy products, as well as fried and fast foods. Although red meat can be consumed in moderation, studies, including a significant one published in *Diabetes and Metabolism*, have shown that excessive consumption of saturated fats can worsen fatty liver more than fructose. Instead of consuming too much saturated fat, it's better to replace them with healthier fats such as polyunsaturated and monounsaturated fats. These healthier fats are found in fish, nuts, seeds, and avocados. For example, olive oil is an excellent substitute for more saturated oils like coconut or palm oil, especially if you're following a ketogenic or low-carb diet where fat is the main source of energy. In these diets, the quality of fat is crucial for maintaining metabolic health and promoting effective weight loss. Ketogenic diets, when done properly with a higher proportion of healthy fats, have been shown to be effective for weight loss and improving metabolic health. However, it's essential to focus not just on the amount of fat, but also on its quality. Including high-quality protein sources that are low in saturated fats, such as poultry, fish, legumes, and eggs, can significantly help with satiety and appetite control throughout the day, supporting weight management and liver health. Eating consciously not only helps maintain a healthy liver, but also contributes to preventing chronic diseases like fatty liver and non-alcoholic steatohepatitis, NASH. When it comes to carbohydrates, while ketogenic diets have been successful in treating conditions like fatty liver, many people find it challenging to maintain a no-carbohydrate diet in the long term. Fortunately, it's not necessary to eliminate carbohydrates entirely to combat fatty liver. Instead, focus on the quality and type of carbohydrates. Foods with a low glycemic index, which release glucose more slowly into the bloodstream, are beneficial for liver health. These include fiber-rich legumes, some low-sugar dairy products, non-starchy vegetables, and whole fruits with natural fibers. It's also crucial to consider how these carbohydrates affect weight control and insulin resistance, which are key factors in the progression of fatty liver. Rather than eliminating carbohydrates, a more effective approach is to choose them wisely and practice moderation. High glycemic index carbohydrates, such as white bread, white rice, most breakfast cereals, and processed potatoes, should be consumed carefully because they can negatively impact blood sugar control and liver health. Replacing these with healthier, nutrient-dense, and fiber-rich options can help maintain a healthy weight, improve lipid profiles, reduce insulin resistance, and support overall liver health. Incorporating a variety of whole grains, such as quinoa and brie or barley, can also offer additional benefits due to their fiber and phytonutrient content, which enhance liver function and promote satiety. These dietary changes, combined with regular physical activity and stress management, form a comprehensive approach to treating fatty liver. To summarize, it's crucial to emphasize that fighting fatty liver disease is not limited to diet. Avoiding alcohol consumption is also essential. Regular practice of moderate intensity physical activities, achieving at least 150 minutes weekly, and including resistance exercises or weight training twice a week are proven measures to promote liver health. By following the recommendations presented in this video, you can observe an improvement in liver indicators within a few weeks, as the studies discussed demonstrate. Furthermore, starting these practices as soon as possible is vital to prevent the disease's progression to more severe conditions such as non-alcoholic steatohepatitis, NASH, or fibrosis, which can lead to cirrhosis in advanced stages of liver disease. When cirrhosis is established, the remaining option may be liver transplantation. Therefore, preventive measures and lifestyle changes are fundamental for maintaining liver health. Additionally, regular monitoring of liver health through blood tests and medical evaluations can assist in the early detection and proper treatment of fatty liver disease. When considering the improvement of recovery from fatty liver, in addition to dietary changes with whole foods, one may consider including dietary supplements. It's important to stress that while the proper diet, rich in essential nutrients and unprocessed foods, is the foundation for treating fatty liver, certain supplements have shown efficacy in scientific studies and can be beneficial to enhance liver recovery. Although supplements are not essential for liver repair, they can provide additional support when used correctly. Supplements like alpha-lipoic acid, silymarin, a component of milk thistle, and curcumin, found in turmeric, have antioxidant and anti-inflammatory properties that can aid in liver health. Others, such as vitamin E and omega-3 fatty acids, have also been linked to improvements in fatty liver. It is crucial, however, to consult a healthcare professional before starting any supplementation to ensure that it is appropriate for your individual needs and does not interfere with existing medications or health conditions. The decision to supplement should be an informed one, complementary to the diet and not a substitute for a healthy and balanced diet. Vitamin E has gained attention as a potentially beneficial supplement for individuals suffering from liver conditions, particularly non-alcoholic steatohepatitis, NASH, a more severe form of non-alcoholic fatty liver disease, NAFLD. Clinical trials have shown that administering vitamin E at a dosage of 800 international units (IU) daily can lead to significant improvements in liver function among NASH patients. In these trials, vitamin E supplementation was found to be more effective than a placebo in reducing liver inflammation and improving overall liver health. However, despite these promising results, it is crucial to approach vitamin E supplementation with caution. High dosages of vitamin E, especially those exceeding 400 IU per day, have been linked to potential risks, although the evidence is somewhat inconsistent. Some studies have suggested that excessive intake of vitamin E may be associated with an increased risk of overall mortality and a higher prevalence of prostate cancer. Due to these potential risks, vitamin E supplementation is generally recommended with caution and is primarily advised for individuals with more severe liver conditions, where the potential benefits may outweigh the risks. Given that vitamin E is a fat-soluble vitamin, it can accumulate in the body weight over time, making careful management of its intake even more critical. Unlike water-soluble vitamins that are excreted through urine if consumed in excess, fat-soluble vitamins like vitamin E can build up in fatty tissues and the liver, potentially leading to toxicity if taken in large amounts over an extended period. Therefore, periodic health assessments and consultations with a healthcare provider are essential to ensure that vitamin E supplementation is appropriate for your specific health needs and to monitor any possible adverse effects. For patients with other underlying health conditions, such as cardiovascular disease or certain types of cancer, it's especially important to seek medical guidance before beginning any vitamin E supplementation. While the benefits of vitamin E therapy can be promising for those with specific liver conditions like NASH, it's vital to balance these benefits against the potential risks associated with high dosages. In addition to vitamin E, omega-3 fatty acids have emerged as a beneficial supplement for improving liver health. Omega-3 fatty acids, particularly those found in fish oil supplements rich in docosahexaenoic acid, DHA, have been extensively studied for their positive effects on liver function. A 2018 meta-analysis published in the journal Clinical Nutrition highlighted the benefits of omega-3 supplementation in reducing key liver markers such as alanine aminotransferase, ALT, and aspartate aminotransferase, AST, which are enzymes that indicate liver damage when elevated. Omega-3 fatty acids have also been shown to decrease hepatic fat accumulation, making them a valuable addition to the diet of those with fatty liver disease. Beyond omega-3, choline is another nutrient that has shown promise in supporting liver health. Choline is an essential nutrient found in foods such as eggs, lean meats, dairy products, and certain vegetables. Recent case control studies have demonstrated a strong association between high choline intake and a significant reduction in fatty liver, with some studies reporting an 81% reduction in the prevalence of fatty liver among individuals with high choline intake. Choline plays a critical role in liver function by aiding in the metabolism of fats and preventing their accumulation in the liver. While choline supplements are gaining popularity as a potential treatment for fatty liver, it's important to note that more research is needed to establish their efficacy beyond populations with choline deficiency. Additionally, determining the appropriate dosage for supplementation remains an area of ongoing study. Until more robust data is available, it is generally recommended to obtain choline through a balanced diet rich in choline-containing foods. For those looking to increase their choline intake, focusing on foods rich in this nutrient is advisable. These include not only animal-derived products like eggs, lean meat, and dairy, but also vegetarian options such as yogurt, sunflower seeds, and cruciferous vegetables like broccoli, cauliflower, and cabbage. These foods not only provide choline, but also contribute to the intake of omega-3 fatty acids if seafood is part of the diet. It's important to remember that while supplements like vitamin E and omega-3 can provide additional support in managing liver health, they should not replace a well-balanced diet. A holistic approach to liver health includes a combination of proper nutrition, regular physical activity, and stress management. There are also other substances and nutritional strategies that may help in treating fatty liver, which have not been covered in this discussion. As always, before starting any new supplementation regimen, consulting with a healthcare provider is crucial to ensure that it aligns with your individual health needs and does not interfere with any existing conditions or medications. The information provided here is intended to serve as a starting point for those interested in improving their liver health through informed dietary and supplementation choices. Stay tuned for more informative content, and thank you for watching. We will meet again soon in the next video. Goodbye.